Alrighty, welcome back to the Ask the Expert Show, brought to you by Kemp Rouge and Green, your car accident team. We are here on a lovely Wednesday morning, and today we're going to be talking with an expert in the field of medicine, in particular from coastal jaw surgery. We're going to be chatting with Dr. Michael Pikos. Let's see if we got him over on line one. Doctor, you there?
Yes, I am, Mark.
Dr. Pikos, nice to have you on the Ask the Expert Show. I want to tee you up a little bit, Doc, and tell everybody a little bit about you from the world-renowned Implant and Oral and Maxillofacial Surgery Centers, which you started the first one. You opened your first office in 1983. And since then, you've got 5 locations across Tampa Bay area. Coastal Jaw Surgery, for those of you who are listening and want to get information while we're chatting this morning, you can go right over to coastaljaw.com, and you'll learn more about their surgery centers and also Dr. Michael Pikos. But by the way, Doc, did I get that right? Is it Pikos?
It is. That is correct. Yes, most folks don't quite get the intonation correctly, but that's spot on.
All right, perfect. Well, I got to tell you, I went online and was looking at some videos, and, people introduce you at all these special and important events that you've been speaking at, and all over the years, there's different stuff you can find out about you, and I heard it, pronounced a couple of different ways, but I was like, I think it's got to be Pikos. Well, I appreciate you being on the show today. We've got a very important topic, and in particular, we're going to talk about same-day teeth. This is something that is absolutely new to me. But before we get into that, I just want you to give 30-second background, your history in and around the field, and also in, of course, I know you've been around Tampa Bay for a long time as well. Tell everybody a little bit about who you are.
Well, first things first, it's a pleasure to be on your program. I very much look forward to this interview. I originally from Ohio, from the Youngstown area, northeastern Ohio, Campbell, Ohio. Came to Florida in 1983, and at that time set up private practice as a solo practitioner. My dad, the roots are in Tarpon Springs, Florida. We're Greek ancestry, so Dad was born and raised in the area, and after World War II, became a carpenter and a welder. The jobs were up north, so he settled there. And long and short of it is I came in 83 and then moved Mom and Dad down in 85. So it's been 38 years of private practice. I've thoroughly enjoyed my time here. As you mentioned, we have 5 locations now in the area, and there are 4 of us that are oral maxillofacial surgeons. 2 of us are periodontists, and we have a prosthodontist. So in essence, we're the only group practice like this in Tampa Bay, where we have a true multidisciplinary approach to what we do in the surgical field of implants and periodontics. So in a nutshell, we're able to focus primarily on dental implants, and as a result, personally I've placed now over 30,000 implants, dental implants over these years, and it's become more of a hobby than anything else, quite honestly. I thoroughly enjoy doing what I do, and most importantly, now mentoring the younger clinicians that are with me, all 30-somethings. I'm the dad figure, if you will, of the practice,
right.
But still enjoy it. And again, we have been able to, I think, make quite an impact in the Bay Area with treating so many patients over the years in all areas of oral surgery and periodontics, but zeroing in on dental implants.
Well, let's dive right in then. Let's talk about what is same-day teeth. Explain that to me, because it sounds like something I think I might know the answer, but what are same-day teeth and how does it work?
Sure. Basically, it's a phrase that I actually trademarked more than 12, 13 years ago, is more or less a moniker for a specific procedure that we do, and that is we are able to help folks who come to us with no teeth, literally wearing dentures, or some of them don't even wear their dentures, but they come to us with either no teeth or teeth that are really not in good shape to speak of. In other words, they have decay and periodontal issues such that they're going to lose some or all of their teeth eventually. So the long and short of it is we're able to literally at one appointment, thanks to our computer-based approach to what we do, which, by the way, is very unique for this protocol, we're able to plan everything in such a way that the day of the procedure, which in essence is to take teeth out and place implants and put permanent teeth in all at one time, this is done at the office, and we have an anesthesia team as well involved. So we basically have under one roof a surgical team, a restorative team that make the teeth, and then an anesthesia team. So that makes us extremely unique in and of itself. But more importantly is that we're changing people's lives in being able to transform them from either no teeth or very bad teeth to all of a sudden teeth that are absolutely very good looking, and in some cases right off the bat drop dead gorgeous. But more importantly is the self-image change we see in our patients because of this protocol. They have suffered for many years with, again, wearing dentures, eating very basic soft foods, etc. They're ashamed of their smile. They've not seen a dentist in many cases for 10, 15 years, so they're very phobic, very afraid. And we're able to accommodate them quite well in such a way that when all is said and done, we can transform literally their lives in one actual surgical visit. So it's a very unique procedure. Other protocols are very similar to what we do, but we're unique in that we're so computer-based that it makes the precision element is absolutely incredible and unprecedented.
That's got to be amazing, especially knowing how important teeth are to people, not just from a standpoint of a health standpoint, being able to eat right and the care of your mouth and oral care, but also the emotional side, right? I mean, I imagine it's got to be a blessing to see how much it transforms someone's life when they go through this process, right?
It is. It truly is. In fact, that gives us so much satisfaction as clinicians. I think we benefit, and sometimes, in some cases, even more than our patients, as we see the instant gratification. Because what's really interesting about this protocol is that initially we're giving our patients permanent teeth that is the first set of teeth, if you will, for a period of approximately 4 months. And during that time frame, they may not like color, shape, size, whatever of something that can be changed ultimately, so that when they get their final permanent set of teeth, so they get 2 sets of permanent teeth, but the second set is many times spot on for like the first one, except it's made of a different material, or maybe some modifications need to be done, et cetera. But the long and short of it is they have a time frame during which they're eating soft foods only, but again, during which they can change anything they so desire. But it's a real art and science, I would say that for sure. And the art of it is in that the teeth themselves have to be shaped and customized. In fact, our entire treatment is customized to our patient. So one size does not fit all, which is very important to note. We're not an assembly line kind of situation at all, far from it. We pride ourselves in customizing our treatment plan, meaning the specific kinds of implants that we place, where they're placed, and as importantly, how the teeth are made so that they don't look generic, which can happen and really result in a lot of disappointment.
Sure. We
take pride in customizing what we do to each of our patients.
Well, how does a patient know if they qualify for same-day teeth procedure?
A great question. Quite honestly, unless we're able to see them in person, of course, and most importantly, take a three-dimensional radiograph called a CBCT or cone beam CT scan. With that combination, we can tell rather quickly, within no time, whether or not they really need to have full work done in both upper and or lower jaw. There are a number of patients we see, and they think they qualify for this because they've seen maybe some of our advertisement and or talk to other patients, et cetera, whereas in fact they only need a few teeth to be removed and can be still replaced with implants and permanent teeth, but not all of their teeth.
Gotcha. Well, we're chatting right now with Dr. Michael Pikos. He is the founder of the world-renowned Coastal Jaw Surgery. And as a matter of fact, they have 5 locations across Tampa Bay. You can find out more information about them at coastaljaw.com. Now, by the way, Doc, you mentioned you're from Ohio. You didn't mention, of course, that you went to Ohio State University College of Dentistry. You graduated summa cum laude and also graduated with honors. And, I think that says a lot about someone in their academic studies, but also thinking about over the last 30 years or so, you've performed these procedures over 30,000 times. That kind of makes you an expert in this field, right?
Well, I guess you could say that. I do. Well, you mentioned my background. I'm a summa cum laude and Phi Beta Kappa graduate, which Phi Beta Kappa part of it really is equally as important to me because it really speaks to a large, broad background of undergraduate work, which I prided myself in. Taking a number of language courses and history and you name it, not just science. But then dovetail that later into real life. It really made a difference as I realized later. But as importantly, yes, it's been impressive to be able to, for me, to be able to help so many patients over the years with not just numbers of implants and procedures, but being able to pioneer a number of procedures as well. I have a Pikos Institute as well for 31 years now, where I've taught more than 5,000 clinicians from all over the world in all 50 states and 43 countries. So, and that's still ongoing. We do approximately 10 courses per year. So it makes me really keep cutting edge with all the procedures that I do, and in turn bring that to our practice. So the 3 other oral surgeons that are with me and our 2 periodontists really benefit quite a bit from that, so that we really can pride ourselves in saying that what we do here is as good as it gets anywhere literally in the world.
And that's wonderful, thinking right here in the Tampa Bay area, we've got this level of skill and expertise in the area of jaw surgery. You can find out more about Coastal Jaw Surgery at coastaljaw.com. We've got about 30 seconds, Doc, and I'd like for you to speak to someone who's listening to the show right now before we head to break. And who is the best candidate for the services that you offer at Coastal Jaw Surgery?
That would be a twofold answer. One being, again, that person who is now wearing dentures and is just literally suffering from not being able to eat and chew well, denture sores, limited foods that person can eat, etc., and not to mention the embarrassment of the teeth moving around and having to glue them in, so to speak. The other category of patient would be one, again, that comes to us with just a lot of bad decay and or chronic gum disease, where teeth are loose and or there's gum swelling and infections and ongoing problems in that respect, and they're just uncomfortable and miserable and unhappy with themselves, especially their smile. So
Gotcha.
it's really a 2-group scenario that we can handle, I should say, focus on the most.
All right. Well, that probably speaks to a lot of people right now driving around Tampa Bay and listening to this show. You're listening to the Ask the Expert show, brought to you by Kemp Rouge and Green, your car accident team, and we're going to be back right after this quick break. We're chatting with Dr. Michael Pikos. He is the founder of Coastal Jaw Surgery with 5 locations across Tampa Bay. You can find out more about them at coastaljaw.com.